Welcome to PrepPass. Here are 50 real certified nursing assistant practice questions with answers for 2026. Read each question, then try to answer before the 5-second timer runs out. For the full free practice test, just search preppass.org. Let's begin. Question 1. A resident in a California skilled nursing facility refuses her scheduled bath. The CNA should A. Bathe the resident anyway because hygiene is medically required. B. Honor the refusal, document it, and notify the charge nurse. C. Tell the resident she will lose her dinner privileges if she refuses. D. Have 2 staff hold the resident still and proceed quickly. The correct answer is B. Under 42 CFR Section 483.10a and California HSC Section 1599.65, residents have the right to be treated with dignity and to make choices about care, including the right to refuse treatment. Question 2. A resident's adult son calls the facility asking what medications his mother is taking. The CNA should A. Read the medication list to him since he is family. B. Tell him the medications but ask him not to share. C. Refer the caller to the charge nurse without confirming or denying any clinical information. D. Tell him to come in person and the CNA will show him the chart. The correct answer is C. HIPAA Privacy Rule, 45 CFR Section 164.502. and 42 CFR Section 483.10g, protect resident health information. Question 3. Which of the following best reflects a resident's right to participate in care planning? A. The interdisciplinary team writes the plan and then informs the resident. B. Family members must approve the plan before it is shared with the resident. C. The resident may attend only if the physician agrees. D. The resident and chosen representative must be invited to participate in developing and reviewing the plan of care. The correct answer is D. 42 CFR Section 483.10 F8 and HSC Section 1599.1 establish the resident's right to participate in the development, review, and revision of the comprehensive care plan, including the right to choose a representative. Question 4. A nurse orders a vest restraint because a resident keeps trying to get out of bed at night. Before applying it, the CNA knows that under federal restraint rules, A. Any restraint may be used as long as a nurse orders it. B. Restraints may be used only when less restrictive interventions have been tried and failed, and only to treat a medical symptom. C. Restraints are routine fall prevention tools for all residents over 80. D. Family verbal consent alone authorizes restraint use. The correct answer is B. 42 CFR Section 483.12 A2 prohibits restraints imposed for discipline or staff convenience and requires they be used only to treat the resident's medical symptoms after less restrictive interventions, bed alarms, low beds, frequent rounding, toileting schedule, have been tried. Question 5. While giving perineal care, a CNA notices the room door is open and visitors are walking past. The CNA should first, A. Continue care quickly to minimize exposure time. B. Move the resident to the bathroom mid-task. C. Close the door, pull the privacy curtain, and cover the resident with a bath blanket. D. Ask visitors in the hallway to look away. The correct answer is C. The right to personal privacy and dignity during care is guaranteed by 42 CFR Section 483.10e and California HSC Section 1599.74. Best practice is to close the door, pull the privacy curtain, and drape the resident with a bath blanket exposing only the area being cleaned. Question 6. A resident has assigned POLST indicating do not resuscitate, DNR, and comfort measures only. The resident becomes unresponsive with no pulse. The CNA should A. Call for the nurse immediately and not start CPR, consistent with the POLST. B. Begin CPR because every patient must be resuscitated regardless of paperwork. C. Wait until the family arrives to decide what to do. D. Move the resident to a chair to make breathing easier. The correct answer is A. Under the Patient Self-Determination Act and 42 CFR Section 483.10, c. 6, residents may direct refusal of life-sustaining treatment through advance directives and California POLST. Question 7. A long-term care resident wishes to vote in the November election but cannot leave the facility. Under federal residents' rights, the facility must A. Discourage voting because it overstimulates the resident. B. Reasonably accommodate the resident's right to vote, including assistance obtaining a vote by mail ballot. C. Vote on behalf of the resident based on stated preferences. D. Require a physician's note before allowing voting. The correct answer is B. 42 CFR Section 483.10 F. 11 protects residents' rights to exercise their rights as citizens, including voting. Question 8. A resident tells the CNA, "I want to file a complaint about how the night staff speaks to me." The CNA should A. Tell the resident complaints rarely change anything and to let it go. B. Wait until the next care conference, weeks away, to bring it up. C. Investigate the staff personally before forwarding anything. D. Inform the resident of the grievance process and assist in contacting the grievance officer or ombudsman without retaliation. The correct answer is D. 42 CFR Section 483.10 J. and HSC Section 1599.2 guarantee the right to voice grievances without discrimination or reprisal and require facilities to have a grievance officer with prompt written response. Question 9. A resident asks the CNA to hold $40 in cash for her in the CNA's pocket. The correct response is A. Hold the cash and return it at the end of shift. B. Decline and direct the resident to the facility's resident personal funds account managed by the business office. C. Spend it on her behalf at the gift shop. D. Give it to the resident's roommate for safekeeping. The correct answer is B. 42 CFR Section 483.10 F. 10. and HSC Section 1599.81 require facilities to safeguard resident personal funds in a separate accounting system with quarterly statements, and prohibit staff from commingling resident funds with personal property. Question 10. A resident asks to read her own medical record. Under the right to access records, the facility must allow access, A. Only with physician-written approval. B. Only if family is present. C. Within 24 hours of an oral or written request, and provide copies within 2 working days, charges may apply. D. Only after discharge. The correct answer is C. Per 42 CFR Section 483.10 G. 2, and California HSC Section 1599.78. Residents have the right to access their records upon oral or written request within 24 hours, excluding weekends/holidays, and to receive copies within 2 working days at a reasonable cost. Question 11. Which of the following is an example of psychological abuse that must be reported? A. Reminding a resident of the meal time. B. Asking a resident to wait briefly while the CNA finishes another task. C. Documenting a refusal of medication in the chart. D. Calling the resident old fool and laughing when she spills her drink. The correct answer is D. 42 CFR Section 483.12 A1 prohibits verbal, mental, physical, and sexual abuse. Name-calling, humiliation, ridicule, and threats are psychological/verbal abuse and must be reported under WNI Section 15630. Question 12. A CNA is discussing a resident's diagnosis with another CNA in the hallway near the elevator. This is a HIPAA confidentiality violation. Discussions must occur in private and only with those who need to know. B. Acceptable because both are facility staff. C. Acceptable as long as the resident's name is not used loudly. D. Acceptable when the elevator door is closed. The correct answer is A. HIPAA, 45 CFR Section 164.530 and 42 CFR Section 483.10 H require minimum necessary disclosure and reasonable safeguards. Question 13. A transgender resident asks staff to use her chosen name and she/her pronouns. Under California's LGBT Long-Term Care Bill of Rights, staff must A. Use the resident's legal name regardless of preference. B. Use the resident's preferred name and pronouns. Willful and repeated failure is unlawful discrimination. C. Use whichever name the family chooses. D. Defer to the physician's notes only. The correct answer is B. HSC Section 1439.51 makes it unlawful for California long-term care facilities to willfully and repeatedly fail to use a resident's preferred name or pronouns, or to deny appropriate room assignment by gender identity. Question 14. When sharing a semi-private room, residents' rights to privacy include A. Being told to keep the curtain open at all times to allow staff observation. B. Sharing the same bath linens to save laundry. C. Allowing the roommate to listen to phone calls so the call can be monitored. D. Use of privacy curtains during care, private telephone access, and private space for visits with spouses or partners. The correct answer is D. 42 CFR Section 483.10 E3 requires accommodation of privacy needs in shared rooms, privacy curtains during personal care, private telephone access, and private space for visits, including with spouses/partners. Question 15. An alert resident states she does not want a feeding tube even if she stops eating. The CNA should A. Inform the nurse so the wish can be documented in an advance directive and care plan. B. Tell her she has no choice once she cannot eat. C. Promise her the doctor will decide later. D. Tell her family to overrule her. The correct answer is A. 42 CFR Section 483.10 C7 and HSC Section 1418.8 protect a competent adult's right to formulate advance directives and refuse treatment, including artificial nutrition and hydration. Question 16. California Title 22 Section 72527 Patient's Bill of Rights must be A. Read silently to the resident by the CNA. B. Provided in writing to the resident and posted prominently in the facility in English and the primary languages of residents. C. Kept only in the administrator's office. D. Given only when the family requests it. The correct answer is B. 22 CCR Section 72527 requires SNFs to provide each patient, or representative, a written copy of the patient's Bill of Rights upon admission and to post it prominently. CDPH guidance requires translation into the primary languages of residents served. Question 17. Which of the following CNA documentation entries is most appropriate? A. Resident was rude today. B. Resident ate 75% of breakfast, refused shower stating she wanted to rest, voided 200 milliliters clear yellow urine. C. Resident is depressed and needs Prozac. D. Family is difficult. The correct answer is B. Per 42 CFR Section 483.20 G. Documentation must be accurate, objective, factual, timely, and within scope of practice. Option B. Records measurable facts, intake percent, refusal with stated reason, output amount, and characteristics. Question 18. A resident who is profoundly deaf communicates in ASL. To explain a transfer procedure, the facility should A. Have the CNA write everything on a small whiteboard at speed. B. Use family members to sign. C. Provide a qualified sign language interpreter, in person or via video, for substantive clinical communication. D. Speak slowly and loudly so the resident can lip read. The correct answer is C. The ADA, 28 CFR Section 35.160, requires effective communication, which for many deaf individuals means a qualified ASL interpreter, not written notes, which assume English literacy, or family. Question 19. A Vietnamese Buddhist resident is dying. The family asks that monks be allowed in to chant at the bedside through the night. The CNA should A. Coordinate with the nurse in charge to accommodate the religious practice, providing private space and minimizing interruptions. B. Tell the family chanting disturbs other residents and deny entry. C. Allow only one monk for 10 minutes. D. Ask the family to chant silently. The correct answer is A. Cultural and religious end-of-life practices are protected expressions of resident dignity under 42 CFR Section 483.10 E. Buddhist chanting, Catholic last rites, Filipino prayer vigils, and Latinx novenas are end-of-life rituals that should be accommodated. Question 20. A resident says, I just want to die. The most therapeutic CNA response is A. Don't talk like that, you have so much to live for. B. That sounds really painful. Can you tell me more about what you're feeling? I will let the nurse know right away. C. Everyone feels that way sometimes. D. Change the subject to lunch. The correct answer is B. Therapeutic communication uses open-ended invitation, validation, and immediate escalation when statements suggest suicidal ideation. Reassurance cliches, A. C, and topic change, D. Shut down the resident and miss safety risk. Question 21. A Latina resident insists on drinking agua tibia, warm water, instead of ice water, citing cultural beliefs about hot/cold balance. The CNA should A. Insist on ice water because it is standard. B. Document refusal and offer nothing. C. Tell her cultural beliefs do not apply in healthcare. D. Accommodate the preference for warm water provided fluid intake remains adequate and there is no medical contraindication. The correct answer is D. Cultural humility and person-centered care require accommodating fluid temperature preferences. Many cultures, Latinx caliente/frio, Vietnamese am/dung, Chinese hot/cold yin-yang, link beverage temperature to wellness. Question 22. A nonverbal resident with end-stage dementia grimaces, moans, and guards the abdomen during repositioning. The CNA should interpret this as A. Normal behavior, no action needed. B. Attention-seeking. C. Possible pain, stop care, ensure safety, and report to the nurse for assessment using a tool such as PainAd. D. Hunger. The correct answer is C. Nonverbal cues, grimacing, moaning, guarding, withdrawal, tense posture, are valid pain indicators in cognitively impaired residents, assessed with tools such as PainAd or FLAC. Question 23. The nurse gives the CNA a verbal instruction: get a clean catch urine on Mrs. Park before lunch. The CNA should A. Repeat back, clean catch urine on Mrs. Park before lunch, got it. B. Nod silently and walk away. C. Wait for the order to be written before doing anything. D. Ask another CNA what was said. The correct answer is A. Joint Commission. National patient safety goals require readback/repeatback for verbal communications to prevent error. Repeating ensures both parties confirm the same task, resident, and timeframe. Question 24. When entering the room of a visually impaired resident, the CNA should A. Begin care silently to avoid startling. B. Touch the resident first before speaking. C. Rearrange furniture to facilitate care. D. Knock, identify themselves by name and role, and explain each step before doing it. Do not move personal items without permission. The correct answer is D. Best practice with visually impaired residents: announce presence, knock, state name/role, describe each action before touching, narrate movements, and never relocate personal items, which are placed for navigation. Question 25. Which of the following is an example of active listening? A. Interrupting with advice as soon as the resident pauses. B. Watching the clock while the resident speaks. C. Finishing the resident's sentences. D. Maintaining eye contact, nodding, paraphrasing what was said, and asking open-ended follow-up questions. The correct answer is D. Active listening uses verbal and nonverbal techniques: eye contact, nodding, paraphrasing, it sounds like, and open-ended follow-up, tell me more, to convey understanding and elicit further information. Question 26. Effective hand washing with soap and water requires a minimum of A. 5 seconds of scrubbing. B. 20 seconds of vigorous friction with soap covering all surfaces, including between fingers, under nails, wrists. C. Rinsing under cold water without soap. D. Air drying without towel. The correct answer is B. CDC hand washing guidance specifies at least 20 seconds of vigorous friction with soap on all hand surfaces, including between fingers, under nails, and wrists, then rinse and dry with a clean towel, turning off the faucet with the towel. Question 27. Proper order for donning PPE before entering a contact plus droplet isolation room is A. Hand hygiene, gown, mask, goggles/face shield, gloves. B. Gloves, gown, mask, goggles. C. Mask, gloves, gown, goggles. D. Goggles, gloves, mask, gown. The correct answer is A. CDC PPE donning sequence is hand hygiene gown mask/respirator goggles or face shield gloves, gloves pulled over gown cuffs. Doffing is in opposite order: gloves, goggles, gown, mask, with hand hygiene between steps and again at the end. Question 28. A resident with active pulmonary tuberculosis requires A. Standard precautions only. B. Contact precautions. C. Airborne precautions, AIIR, negative pressure room, N95 or PPR for staff, door kept closed. D. Droplet precautions with surgical mask only. The correct answer is C. TB is transmitted by airborne droplet nuclei. CDC requires airborne infection isolation room, negative pressure with at least 6 air changes/hour, exhausted outdoors or through HEPA, N95 respirator, fit tested, or PAPR for staff, and door kept closed. Question 29. The correct disposal of a used disposable razor with visible blood is A. Immediately drop it into a rigid puncture-resistant red sharps container, never recap or pass hand to hand. B. Wrap in tissue and place in regular trash. C. Flush down the toilet. D. A place in the soiled linen hamper. The correct answer is A. OSHA 29 CFR Section 1910.1030 requires sharps to be placed in closable, puncture-resistant, leak-proof, labeled biohazard containers immediately at point of use, never recap, bend, or hand pass. Question 30. During a facility fire, the CNA uses the RACE acronym. RACE stands for A. Run, Alert, Cover, Escape. B. React, Activate, Cool, Eliminate. C. Rescue, those in immediate danger, alarm, pull and call 911, contain, close doors, extinguish or evacuate. D. Read, Avoid, Carry, Empty. The correct answer is C. RACE is the standard fire response acronym. Rescue residents in immediate danger, sound the alarm and call 911, contain the fire by closing doors and windows, and extinguish if small/safe or evacuate per plan. Question 31. Proper body mechanics when assisting a resident to stand from bed include A. Wide stance, bend knees and hips, not back, keep load close, lift with legs, use gait belt and ask for help when needed. B. Bend at the waist with knees straight. C. Twist the spine to lift. D. Lift alone regardless of resident weight. The correct answer is A. OSHA ergonomic principles for safe patient handling. Feet shoulder width apart, bend knees and hips, keep back straight and load close, pivot rather than twist, use gait belt for controlled assist, and use mechanical lifts and two-person assist per the resident's mobility plan. Question 32. Oxygen safety in a resident's room includes A. No smoking, no open flames, no petroleum-based products on the face, post oxygen in use sign, keep tubing free of kinks. B. Allowing scented candles for relaxation. C. Using petroleum jelly on lips and nostrils. D. Storing tanks horizontally near heat vents. The correct answer is A. Oxygen accelerates combustion. Question 33. A CNA is unsure how to safely use a new disinfectant spray. The CNA should A. Guess based on similar products. B. Mix it with other cleaners to make it stronger. C. Pour it into an unlabeled spray bottle. D. Read the product label and the safety data sheet, SDS, located in the housekeeping/utility area, and ask the supervisor. The correct answer is D. OSHA Hazard Communication Standard, 29 CFR Section 1910.1200, requires safety data sheets, SDS, to be readily accessible to all employees. The SDS lists hazards, required PPE, dilution ratio, surface contact time, first aid, and disposal instructions. Question 34. When entering the room of a resident on contact precautions for MRSA, the CNA must A. Wear only gloves. B. Don gown and gloves before entry, remove and perform hand hygiene before exiting, use dedicated equipment when possible. C. Skip PPE if just dropping off a tray. D. Wear an N95 respirator. The correct answer is B. MRSA spreads by contact. CDC contact precautions require gown and gloves donned before room entry and removed before exit, with hand hygiene immediately after removal. Dedicated equipment, BP cuff, stethoscope, thermometer, reduces cross-contamination. Question 35. A bed pad saturated with blood and stool must be discarded into A. Regular trash if double-bagged. B. The linen hamper. C. A red biohazard bag labeled with the biohazard symbol. D. The recycling bin. The correct answer is C. OSHA 29 CFR Section 1910.1030 requires items saturated with blood or other potentially infectious material to be placed in red biohazard labeled bags for regulated medical waste disposal. Question 36. Which is not a least restrictive alternative to a physical restraint? A. Low bed with floor mat. B. Bed/chair alarm and frequent rounding. C. Wedge cushion to maintain alignment in a wheelchair. D. Tying the resident's wrists to the bed rails just in case. The correct answer is D. Least restrictive interventions include low beds, floor mats, alarms, scheduled toileting, recliner positioning, activity engagement, and environmental modifications. Question 37. Alcohol-based hand rub is preferred over soap and water except when A. Hands are visibly soiled, after caring for a C. difficile or norovirus patient, before eating, after toileting. B. Between residents. C. Before donning gloves. D. After removing gloves. The correct answer is A. CDC guidance. Alcohol-based hand rub, 60 to 95% alcohol, is preferred for most clinical encounters because it is fast and more effective than hand washing for non-spore organisms. Question 38. A resident is in airborne plus contact isolation for COVID-19. Required PPE for routine care includes A. Surgical mask and gloves only. B. Gown and gloves only. C. N95 respirator, fit-tested, or PAPR, eye protection, goggles or face shield, gown, and gloves. D. Standard precautions only. The correct answer is C. Per updated CDC/CDPHSNF guidance, COVID-19 care requires N95 respirator, or PAPR, for staff entering the room because aerosol generation can occur, plus eye protection, gown, and gloves. Question 39. After removing gloves, the CNA should A. Perform hand hygiene immediately before touching anything else. B. Reuse the gloves on the next resident. C. Wait until after the next task. D. Place used gloves in a pocket. The correct answer is A. CDC and WHO 5 moments require hand hygiene immediately after glove removal because microbes contaminate hands during use and doffing through microtears and during the removal process. Question 40. PASS, the fire extinguisher acronym, stands for A. Push, activate, spray, stop. B. Pull the pin, aim, at the base of the fire, squeeze, the handle, sweep, side to side. C. Point, aim, squeeze, stop. D. Pull, apply, spray, sweep. The correct answer is B. PASS is the Universal Fire Extinguisher Operation acronym. Pull the pin to break the seal, aim at the base of the flames, not the flames themselves, squeeze the handle to release the agent, and sweep side to side until the fire is out. Stand 6 to 8 feet back. Question 41. Linen that is wet with blood should be A. Carried in arms to the laundry. B. Rinsed in the sink first. C. Bagged at point of use in a leak-resistant red biohazard bag, handled with gloves, not held against the body. D. Placed in the regular linen cart. The correct answer is C. OSHA 29 CFR Section 1910.1030 requires soiled linen to be bagged at point of use in leak-resistant bags, red biohazard if dripping/saturated, handled minimally with gloves, never sorted at bedside, and never held against the uniform. Question 42. The accepted adult normal range for blood pressure is approximately A. 60-90/40 to 60 mm of mercury. B. 140 to 180/90 to 120 mm of mercury. C. Systolic 90 to 120 millimeters of mercury and diastolic 60 to 80 millimeters of mercury. D. Is systolic above 180 millimeters of mercury. The correct answer is C. Normal adult resting BP is roughly systolic 90 to 120 and diastolic 60 to 80 millimeters of mercury, per AHA fundamentals. Question 43. The most commonly used pulse site for routine adult vital signs is the A. Carotid pulse, B. Femoral pulse, C. Pedal pulse, D. Radial pulse, at the thumb side of the wrist, counted for 30 or 60 seconds. The correct answer is D. The radial pulse is the standard for routine adult vital signs, accessible, comfortable, and reliable. Question 44. Normal adult respiratory rate is A. 5 to 10 breaths per minute, B. 12 to 20 breaths per minute, C. 25 to 40 breaths per minute, D. Variable, no normal range. The correct answer is B. Normal adult respirations are 12 to 20 breaths per minute at rest. Bradypnea, less than 12, may indicate opioid effect or neurologic compromise. Tachypnea, greater than 20, may indicate fever, pain, hypoxia, or respiratory distress. Question 45. Normal adult oral temperature range is approximately A. 94 to 96 degrees Fahrenheit, B. 100 to 102 degrees Fahrenheit, C. 97.0 to 99.0 degrees Fahrenheit, about 36.1 to 37.2 degrees Celsius. A fever is generally greater than or equal to 100.4 degrees Fahrenheit, 38.0 degrees Celsius. D. Above 102 degrees Fahrenheit. The correct answer is C. Normal oral temperature is approximately 97.0 to 99.0 degrees Fahrenheit, 36.1 to 37.2 degrees Celsius. Axillary readings run about 1 degree Fahrenheit lower, while rectal readings run about 1 degree Fahrenheit higher. Question 46. Oral temperature is contraindicated for residents who A. Have just walked back from the bathroom, B. Drank ice water 30 minutes ago, C. Ate hot soup 5 minutes ago, D. Are unconscious, confused, on oxygen by mask, mouth breathing, or who have had oral surgery. The correct answer is D. Oral temperature is unsafe or inaccurate in unconscious, confused, seizure-prone, oxygen mask, mouth breathing, or post-oral surgery residents. Alternative routes, axillary, temporal, tympanic, should be used. Question 47. For a cognitively intact resident, the most commonly used pain scale is A. PAINAD, for dementia, B. 0 to 10 numeric rating scale, 0 equals no pain, 10 equals worst imaginable pain, or Wong-Baker faces, C. FLAC, for infants, D. Glasgow Coma Scale. The correct answer is B. For verbal cognitively intact adults, the 0 to 10 numeric scale or Wong-Baker faces, useful for limited literacy or language barriers, is standard. Question 48. The position with the head of the bed elevated 45 to 60 degrees is called A. Supine, B. Prone, C. Fowlers. Semi-Fowlers is 30 to 45 degrees, high Fowlers is 60 to 90 degrees. D. Is Sims. The correct answer is C. Fowler's position, 45 to 60 degrees HOB elevation, supports breathing, eating, and aspiration prevention by reducing reflux and using gravity to keep the airway protected. Question 49. When transferring a resident with right-sided weakness from bed to wheelchair, the CNA should position the wheelchair, A. on the weak, right, side, B. on the strong, left, side, at a 45 degrees angle to the bed, with wheels locked, footrests up, C. behind the bed, D. across the room. The correct answer is B. Position the wheelchair on the resident's strong side at about 45 degrees to allow weight bearing through the stronger leg during the pivot. Lock wheels, raise footrests, and apply a gait belt for control. Question 50. During a complete bed bath, the CNA washes the eyes, A. last, with soap, B. with the same washcloth side used for the body, C. from outer to inner canthus, D. from inner to outer canthus using a different corner of the washcloth for each eye, with water only, no soap. The correct answer is D. Eye care during bathing, use water only, no soap, wipe from inner canthus, near nose, outward to avoid contaminating the nasolacrimal duct, and use a separate clean corner of the cloth for each eye to prevent cross-contamination. That's all 50 questions. Want the full CNA practice test with hundreds of questions, completely free? Just search PrepPass.org. Good luck on your exam.